In this video, we're going to be going over standing sciatic exercise so you can find the relief that you're looking for. Hi, this is Dr. Ken, your sports chiropractor and certified athletic trainer. And today, if you are currently experiencing sciatica pain, and especially it's worse while you're sitting, then let's try these standing sciatic exercises so you can find the pain relief that you're looking for. First, what we need is a yoga block and a flat wall. And what we're going to be doing is placing this yoga block right at the base of our SI joint. If I were to show you what's going on in the spine model, we're going to see our SI joints, which is the two bony prominences on our lower back. So if you feel around your lower back and you feel a bone sticking out, it's probably one of these guys. Now we're going to place this yoga block right on that area and then go against the wall like this. Make sure that it's right on that bony prominence and feet shoulder width apart so that you can remain balanced. And what we're going to be doing is you can hold on to this yoga block just in case so that it's stable, or you can cross your arms like this and go ahead, and what we're going to do is we're going to lean back into the wall only to the point where it's comfortable. So if it's too much, lean forward just a little bit. But what we're trying to do is we're trying to get this extension in our lower back. And so by doing that, we want to hold this for about 15 to 30 seconds. Again, if you feel a little bit unbalanced, you can hold the yoga block and do the same thing. So we're going to go back 15 to 30 seconds. We're going to hold only to what you can handle. Now, if you can't handle this because of the pain or there's an increase in symptoms, then please stop immediately. This exercise is not for you. What we're looking for is symptoms of the numbness tingling that's going down our leg, going back towards to our spine. That's called centralization. That is an important part of this exercise, that we look for the centralization. The numbness and tingling that may be going down to our toes or to our ankles is slowly going up towards our thighs, to our glutes, and back to the spine. That's going to be the goal. Again, we want to do this as many times throughout the day as we can. Sometimes I have patients doing from 50 to 100 reps of this 15 to 30 second holds, because it's the best exercise when you get into that extension. It helps to decompress the disc, open up the space for the nerves, and you feel that centralization occur and the pain reducing. So right here, again, yoga block against the wall, flat, right on the SI joint, going back, extension, hold for 15 to 30 seconds, or to what you can handle, and do these as many times throughout the day as you can. Some people it might be 10, but for most, I believe you could even go up to 100 times. And once we finish that, we can actually work our way up from this bony prominence, one segment up, one segment up, one segment up, so that we can hit each spot effectively. So we can go a little higher, extend back and hold. Now once we finish that, go a little higher, extend back and hold. Now at any point this exercise increases pain or increases the symptoms, please immediately stop, because this exercise is not for you. The next exercise is going to be a lateralization standing exercise. Now what we're going to be doing is getting our elbows and our forearm against this wall and our feet about 12 to 18 inches apart from the wall, just like so. Then we're going to grab the opposite arm, place it on our hips, and drive our hips towards the wall. Now when we do this, again, we're going to hold for 15 to 30 seconds, come back, and repeat. Now again, the amount of pressure that you push in only go to where you can feel a stretch and where it doesn't increase the pain. If this also increases the pain, please immediately stop, because this exercise is not for you. Now, how do you know which side, the affected side, should be closer to the wall or further from the wall? Now, the general rule is that you want the affected side away, the furthest from the wall. However, if you do have sciatic pain on the right and it's closest to the wall, and you try this exercise and it actually feels a lot better, not everyone is textbook. You may actually be the opposite. So this is a case-by-case scenario. So in general, the affected side should be on the further side away from the wall, just like this. So this is the left side. However, for you, it may be a little bit different. So play around with it and see which one gives you the most pain relief and focus on that. This lateralization exercise, we want to do 15 to 30 second holds. And again, you want to do as many reps throughout the day as you can. The final standing exercise for sciatic pain relief is going to be a simple stretch of our hips. So what we're going to be doing is focusing on our feet. We want the affected side on the back side. So in this case scenario, we have affected right side. We want our front foot to be turned in, so our hips are going to be internally rotated, and then our back foot is also going to be internally rotated, just like this. Now when we do this, there are two keys that we have to do. We have to shift our weight to our heels, and then we have to rotate towards the affected side. So again, this is the right side that is affected. That's why the right side is back, and we're gonna rotate our torso towards the affected side. Remember, one of the keys was to keep our weight on our heels, and you should feel a nice stretch in this outer hip. Now, if you want this stretch to become a little bit deeper, I want you to squeeze your glutes while you turn, and that will accentuate the stretch on this outer hip, and that will also help to relieve a lot of the sciatic pain and the muscular tension that you might be experiencing. So again, let's start over. Our affected side is the right side. We're gonna bring our affected side back. Then we're gonna internally rotate our foot and our entire hip in. Then we're gonna internally rotate our back side, the affected side. We're gonna shift our weight to the heels back, and then we're gonna rotate our torso towards the affected side, and then hold. Now, if you can hold this for about 10 to 15 seconds, that's ideal. And then you're gonna relax, and you wanna do about 5 sets of these. Now, when we do this and hold and you don't feel it too much, another way to accentuate this stretch is to, one, go on our heels. When we rotate, squeeze our glutes and our quads, and you'll feel this nice deep stretch right in the hip joint, which will help to relieve your sciatic pain. If you found value to this video, if you're willing, please like and subscribe, and we'll see you in the next video. Aloha.